Oh, hello. I'm gonna do a question on communication. I've got my interview at Newcastle in a week and I want it to be good. So this question is basically when I've seen good communication among doctors and basically how I've shown good communication. There was a time I was shadowing the doctor and I watched him communicate with a patient with dementia, and I really analyzed the, you could say, the non-verbal communication that the doctor was, giving off. So he maintained good eye contact. He went down to the patient's level to prevent like a power gradient. He made sure that the patient was comfortable by, just putting a touch on the shoulder. And he also slowed his speech down because he knew um, that the patient had dementia. So even if he had to repeat himself a couple of times, I feel like doing that allowed the patient to understand what was going on and understand the doctor's questions. And also, he was just very open and he leaned in and gave a lot of attention. And I think through this, the patient became a lot more relaxed and comfortable and was able to relay her concerns. And it really developed a trustworthy patient doctor relationship because the doctor took the time to develop a good rapport with the patient. And I think having good communication skills as a doctor really shows respect and dignity to the patients, especially when you adapt your communication and you don't use medical jargon, because the NHS has a very diverse population and you want to make sure that your patients are well informed so that they can make informed decisions and can have, and it's more of like a mutualistic approach to medicine, where the patients can be, you know, involved in the decision making, and that can do wonders for patient compliance and definitely a better outcome in the end. So I think I've demonstrated good communication skills as my role as a clinical support worker, where I had to help deliver scans to patients, and a patient came in who had severe learning difficulties, and the only way she could communicate was through sign language, and her carer and the sonographer did not know sign language, and I coincidentally was taking sign language classes at the time. The patient became very distressed because I could see that she just didn't know what was going on and what was happening to her, and the instruction of take off your jacket and get onto the chair, that is something that can be very, very distressing to somebody who doesn't understand what's going on. So what I did was, as she was distressed, I tried to calm her down by spelling out my name and asking her what her name is, and eventually she became more relaxed and basically complied to what I was trying to ask her to do, and through that there's consent and she trusted me as well. And the carer really thanks me for me taking the time to, have that adaptability in my communication and not allowing her to go through this traumatic experience again by rescheduling. So I think, as the NHS serves a very diverse population with people from different demographics, you must be able to tailor the way that you communicate. And also communicating in a team is so, so crucial. We're going to be doctors work in a multidisciplinary team, and you're going to be working as a doctor, you work in immediate teams of nurses, PAs, HCAs, and being able to sort of being able to work within them, work between them ensures patient safety and quality care. So overall, I think communication skills is very important trait for doctors to have, to extract necessary information, to reassure patients, to educate patients when needed, and to work effectively in a team.